Hello everyone, welcome to E-Classes by Dr. Adira. This video is to discuss the development of mandible and maxilla. Mandible and maxilla develops from first pharyngeal arch, that is the mandibular arch. Mandibular arch gives a rostral extension on either side known as maxillary process. Once the maxillary process is formed, rest of the mandibular arch can be called as mandibular process. So the bone of mandible develops within the mesenchyme of mandibular process and maxilla develops within the mesenchyme of maxillary process. Mandibular nerve is the first structure to appear in the mandibular process or mandibular arch. It has a great role in development of mandible or initial ossification of mandible. A certain factor released by the mandibular nerve, known as neurotrophic factor, induces osteogenesis or formation of bone of mandible initially. Let's see what is Meckel's cartilage. Meckel's cartilage is the cartilage of first pharyngeal arch. In primitive vertebrates, they form mandible by endochondral ossification. When we say endochondral ossification, the connective tissue first converts into or forms in cartilage, which then converts into bone. That is known as endochondral ossification. But in case of human beings, Meckel's cartilage do not directly contribute to the formation of mandible. Instead, it just give a positional relationship or positional guidance for the developing mandible. So this Meckel's cartilage that extends from the ear region to the midline of the mandibular arch gives a positional guidance to the developing mandible. Is that mandible is formed almost parallel to this Meckel's cartilage. So, and mandible is formed majority by intramembranous ossification, that is directly the mesenchyme of first arch, pharyngeal arch, that is mandibular arch, is converted into bone of mandible. So that is known as intramembranous ossification. Now let's see how is ossification of mandible progressing. By middle of 6th week of intrauterine life, the Meckel's cartilage extends as a solid hyaline cartilaginous rod from the developing ear region to the midline of the mandibular arch, as you can see here. And this cartilage is on either side, Meckel's cartilage is on either side, are separated at the midline by a thin band of mesenchyme. You can see the mandibular nerve here, which is dividing into inferior alveolar nerve and lingual nerve. Mandibular nerve, I told you, it is the first structure to be present in the mandibular arch. And again, the inferior alveolar nerve is getting divided into incisive and mental nerves, incisive branch and mental branches. Why this point of division is important is, it is at this point of division, first bone of mandible will form, or it is the initial site of ossification here at this point of division of inferior alveolar nerve into incisive branch and mental branch. So by 6th week of intrauterine life, at the angle formed by the inferior alveolar nerve, there is condensation of mesenchyme of mandibular arch. By 7th week, at this area, there is formation of bone, that is at the area of condensed mesenchyme, there is beginning of intramembranous ossification, and this is the site of initial ossification of mandible. So from this point of ossification, initial ossification, mandible formation continues anteriorly up to the midline and posteriorly up to the point of lingula or up to the point of division of mandibular nerve into lingual and inferior alveolar nerve. Lingula is the point of entry of inferior alveolar nerve into mandibular canal. And from this point of lingula onwards, mandible formation is in an angle extending away from the Meckel's cartilage, as you can see in this image. Thus, by 10th week of intrauterine life, rudimentary mandible will be formed. Now let's see what happens to Meckel's cartilage after these many developmental events. The most posterior extremity of Meckel's cartilage forms the incus and malleus of middle ear, which are the two ear ossicles out of three. And from the region of spino-sphenoid to the point of lingula, the cartilage is completely degenerating or lost, but the perichondrium and fibrocellular capsule persist, forming this ligament known as spino-mandibular ligament. From the point of lingula to the division of inferior alveolar nerve into Mandible branch and incisive branch, the cartilage will be completely lost in this particular region. And from the point of division of inferior alveolar nerve into Mandible and incisive branch, from this point till the midline in this small region, the Meckel's cartilage may give rise to or contribute to formation of mandible by endochondral ossification. Since the development of mandible is now almost complete into an extent of formation of rudimentary mandible, further growth of mandible occurs by assistance of three secondary cartilages like coronoid, symphyseal and condylar cartilage. So the condylar cartilage, by 12th week of intrauterine life, it forms beneath the fibrous articular layer of future condyle. Undergoes endochondral ossification, that is, the cartilage undergoes ossification to form bone. By 20th week, there is only a thin cap of cartilage present at the condylar head, which is present until the second decade of life and act as a center of growth. As you can see in this region, it is seen at the future condyle region. Next one is coronoid cartilage, in the future coronoid region, which appears by 4th month of development around the anterior border of top of coronoid process, and it disappears long before birth. It is a transient growth cartilage. Symphyseal cartilage is in the midline of this forming mandible, that is in connective tissue between two ends of Meckel's cartilage. We have discussed already, Meckel's cartilage is separated at the midline by a thin band of mesenchyme. It is at this region symphyseal cartilage appears. They are two in number on either side and obliterates from both sides within 1 year of birth. This is how the mandible growth is completed by help of these three secondary cartilages. Now let's move on to development of maxilla. Even here, there is no involvement of any primary cartilage and maxilla is formed totally by intramembranous ossification. That is, the connective tissue or mesenchyme of the maxillary process of the first pharyngeal arch gets converted directly to bone or ossifies directly to form the bone of maxilla. And the center of ossification here also is related to nerve. It is at the point of division of inferior orbital nerve into anterior superior alveolar nerve. So this is the point of initial ossification, or it is the place where first bone of maxilla will form. It is in this mesenchyme the bone formation happens first, or the mesenchyme ossifies first in this region. So from here, from this site of initial ossification, bone formation spreads in various fashion. It spreads anteriorly towards the future incisal region, as you can appreciate here, and towards the palate also it spreads, forming the palatine process of maxilla. It spreads superiorly to form the frontal process of maxilla and posteriorly towards the developing zygoma, and below the orbital region also it spreads. As the bone formation spreads from the center of ossification, a bony trough forms for the infraorbital nerve. This bony trough will have a downward extension which forms the lateral alveolar plate for maxillary tooth. So this is all about the development of maxilla. Both mandible and maxilla develops mainly by intramembranous ossification, and it is developing within the connective tissue or mesenchyme of first pharyngeal arch, that is mandibular arch. In the mandibular arch, it has a process like maxillary process and mandibular process. The maxillary process is the connective tissue of maxillary process give rise to maxilla, and the mesenchyme or connective tissue of mandibular process of first pharyngeal arch give rise to mandible. So that's all about this session. Thank you for listening.